do you think that the public in general is educated and understand that PT can be done virtually? And have you noticed any changes in the mindset of the population since the pandemic hit?
I would say yes and no, knowing the fact that a lot of people don't even know what physical therapists do still. They're still not coming to us as a forefront to their problems, especially musculoskeletal care. They have so many options from chiropractors, massage therapists, neurologists, orthopedists. So just them knowing what we do, especially MDT clinicians, because we're a smaller group that focuses on assessment, not just treatment. So from the aspect of just knowing what we do as PTs, I still think people are limited, although that's grown a ton and the mind shift is slowly shifting for sure. From a telehealth standpoint, previous to March of last year, when everything kind of shut down and telehealth ramped up for a lot of people, my practice really, it was 5% telehealth. And so I've done webinars, I've done conferences, I've talked on telehealth for years. But I kept telling people, look, it's not a majority of my practice. Still, most people want to come in and see me, and seeing them online is kind of foreign, even though they have a cell phone that they'll do FaceTime with consistently with friends and family. So definitely was foreign to people, not something they were very comfortable with. If you mention it to a doctor or a doctor friend, they're like, you're doing what? Through what? So definitely since March of last year, I've definitely seen the being receptive to it. I have lots of patients that are on Medicare that do telehealth, which is something before the pandemic never would have happened, really. It would have been very rare to see that, one, because Medicare didn't cover it, and two, Medicare patients didn't want to pay for it. They wanted to be in the clinic, but they've become much more receptive to the being able to see through telehealth, especially not having to be out in public and be around people with the concern for their health. So I've seen that increase. I've been fortunate enough to be involved in research with Mark Wernicke and some others over the years. And we have a telehealth paper that hopefully will be published soon. And we looked at just kind of the overall component of physical therapists across the country using focus on therapeutic outcomes. How many of those therapists were actually using telehealth through the pandemic? And the number of physical therapists that actually use telehealth is, unbelievably low. It's like 6% if you look at the data. So it's very interesting that even physical therapists aren't using it very much, even though they have that aspect out there to help treat their patients and take care of them. So even during the pandemic, patients may know more about it, but a lot of physical therapists aren't using it. And so it's definitely transitioning and improving as far as accessibility, as far as people being interested. But I don't think it's anywhere close to what any of us really would like for it to be.